Hello and welcome to today's video about depression and its relationship to nervous disorders. Depression can occur for many reasons and affects people of all ages. It is a mental health condition that can have a significant impact on a person's life, leading to isolation, cognitive decline and even suicide. In this video, we'll explore how neurological disorders can cause depression and what can be done to treat it. Nervous disorders, such as multiple sclerosis, epilepsy, traumatic brain injury, Alzheimer's disease, and stroke, have been linked to depression. Studies have shown that more than half of stroke survivors experience depression within the first 3 months, and 25% are diagnosed with depression 2 years later. The relationship between depression and neurological disease is not completely clear, and theories vary depending on the disorder. However, cognitive impairment and other neurological conditions significantly increase the risk of depression, whether a person has had depression before or not. According to Scott Hirsch, a neuropsychiatrist with Contemporary Care of America in Greenwich, CT, sometimes there are purely biological causes for depression in neurological disorders, such as the biochemical changes in the brain caused by stroke. After a stroke, the amygdala, which is the part of the brain involved in emotion regulation, is often damaged, causing decreased levels of the brain-derived neurotrophic factor and the stress hormone cortisol, which can trigger depression. In Parkinson's, depression can be caused by a decrease in dopamine. People who have comorbid conditions such as cancer and diabetes are also more prone to depression. Generally, when people are chronically ill with any condition, not only are they experiencing a nervous breakdown, they can also be depressed, says Hirsch. Psychosocial factors, including social isolation, loneliness and loss, can also contribute to depression. It's important to recognize the signs of depression early, especially if it's caused by a neurological disorder. According to Nada El-Husseini, MD, FAN, a professor of neurology at Duke University Medical Center in Raleigh, North Carolina, some of the most common early signs of depression are sleep disturbances, decreased energy, changes in appetite or activity levels, and decreased concentration. It's easy to ignore these signs or think of them as symptoms of a neurological condition in itself, not depression, she says. Losing interest or pleasure in doing things we once enjoyed is another warning sign. If you or someone you love is depressed due to a disorder in the nervous system, seek help immediately. Talk to your doctor or neurologist and consult a therapist as well. Depression can be managed through lifestyle approaches, medication, and therapy. For starters, it's important to focus on ensuring patients get enough physical activity and sleep well, eat a healthy diet, and avoid excessive alcohol use. Talk therapy can also help people focus on problem solving, manage ruminative thinking, and deal with grief. Antidepressant drugs can also be useful, and doctors will usually recommend the most appropriate medication, which will not cause negative interactions with other drugs that we take. We usually start with small doses to monitor for side effects, says El-Husseini. In clinical trials, we've seen response rates of 50 to 65% to antidepressants in people with neurological conditions. In conclusion, depression can be a severe and debilitating condition, especially when it is associated with a neurological disorder. However, with early recognition and proper treatment, it can be managed. If you or someone you know is experiencing symptoms of depression, seek help immediately. Remember, it's okay to ask for help, and there's nothing wrong with seeking treatment for a mental health condition. Thanks for watching, and we hope you enjoy this video.